And in this lecture, we'll discuss the antibiotic that inhibit the DNA synthesis. And actually, the antibiotic that inhibit the DNA synthesis is the quinolones and metronidazole. So for quinolones, we will focus on ciprofloxacin, levofloxacin, and moxifloxacin. For the ciprofloxacin, the spectrum is covering mainly the gram-negative, mainly the Pseudomonas and atypical microorganism. For the levofloxacin, it have greater coverage. It cover also the Enterococcus, covering the methicillin-sensitive Staph aureus and the Streptococcus pneumoniae, but have no coverage over the anaerobes. On the other hand, for moxifloxacin, it covers Streptococcus pneumoniae, methicillin-sensitive Staph aureus, having coverage with the gram-negative but not Pseudomonas, and also it is the only quinolones that cover the anaerobes. So the main difference between the levo and the moxifloxacin does not cover the Pseudomonas, but the levofloxacin covering the Pseudomonas. The levofloxacin doesn't cover the anaerobes, but the moxifloxacin covers the anaerobes. For the ciprofloxacin and levofloxacin is called urinary quinolones, while the levofloxacin and the moxifloxacin called respiratory fluoroquinolones. And the reason for that, the moxifloxacin is not secreted in the urine, so it cannot be used for urinary tract infection. On the other hand, the ciprofloxacin doesn't cover the Streptococcus pneumoniae, so it cannot be used for respiratory infection. That is why the Cipro used only for abdominal and urinary tract infection, but not used for respiratory infection alone. On the other hand, the moxifloxacin can be used for respiratory infection, but not used in urinary tract infection. The main side effect of the quinolones is agitation and neurotoxicity in the term of agitation, psychosis, and seizures. It also has some effect on the cartilage. It may cause cartilage injury in the children. So it's not FDA approved in age less than 16 years, except the use of ciprofloxacin for short-term in urinary tract infection. For metronidazole, it's mainly covering the anaerobes, and the dose of the metronidazole it has a loading dose of 15 milligram per kilogram over 1 hour. The maintenance dose 7.5 milligram per kilogram every 6 hours. It also can be used in combination for abdominal and enteric infection with other antibacterial, and it is inferior to vancomycin for treatment of Clostridium difficile colitis. The main side effect of the metronidazole is peripheral and optic neuropathy, neurotoxicity in the term of peripheral optic neuropathy, seizures, and encephalopathy, and it also may cause some sort of fiery tongue and metallic taste. Thank you.